forced to flee their homes and go to disaster shelters. It's chaotic and crowded, conditions that are ideal for the spread of disease. But let's say your grandfather is wounded, your uncle forgot his oxygen tank, your daughter is pregnant, and someone in the shelter just caught the flu. How can you make sure that your family gets the medical care that they need while preventing everyone else from getting sick? More than 1.6 million people go through this in the United States every year, and 3 out of 4 of those people have an immediate medical need. So for organizations that run these shelters, like the Red Cross or the Department of Public Health, the problem is that there's a lack of accessible real-time healthcare information for disaster shelters. So in 2017, just between the US government and the Red Cross, more than $470 million were spent on disaster relief healthcare in the United States. Now, if you're looking at international organizations and all disaster relief organizations in the world, that number just increases. So what's the current process? So when an evacuee walks into a shelter, a paper intake form is filled out, the supplies are called in via phone, and then delivered. This phone and paper process is time-consuming and inefficient. Our competitors have developed resource tracking technology, but do not track individual medical needs of disaster shelters. So our solution is DisasterMed, a data management platform that tracks and identifies infectious symptoms and individual medical needs. It tracks this information by location and in real time, allowing organizations like the Red Cross to have a streamlined process to reduce the economic burden of disasters. So here's how it works. So when an evacuee enters a shelter, a medical volunteer will fill out this electronic form with their information. Then that information will be populated onto a map for quick reference by the government and disaster relief organizations. Now we're planning on having a fixed base fee and an annual recurring fee based on the number of users. Currently, disaster data is not being tracked, and so we plan to collect that information for purposes such as predictive analytics. Now, after winning the Southeast Startup Challenge this past June, we plan to enter market quickly, starting with the Southeast. We have already developed key relationships with advisors and mentors that are going to help us market and test our product. We're piloting this hurricane season with the local Medical Reserve Corps and Department of Public Health with the goal of attending conferences this year and launching in 2019. So we want our 6 industries to become an international organization devoted to developing technologies to save victims' lives and improve evacuee outcomes. So we're asking for $160,000 in initial seed round funding, as well as any connections to advisors that are familiar with working with government clients. So with that, thank you for your time.